This is my audience. Could you please introduce yourself and our relationship?
Gwinnett Kinnemer, a friend.
Betty Smith, a friend.
I'm Dee, and I'm a co-worker.
I'm Mandy Banks, and I'm a friend.
I'm Macy Klossmeyer, and I'm a coworker and a friend. Vital signs are an important part of the healthcare system. By taking a person's vital signs regularly, healthcare providers are able to monitor a patient's health and ensure all of their signs are within a normal range. Generally, a full set of vitals include measures of temperature, pulse rate, respiratory rate, blood pressure, and oxygen saturation. The importance of measuring vital signs can be significant in saving somebody's life. Vital means necessary to the maintenance of life. By conducting regular vital sign observations, healthcare providers are able to prevent injury, infection, or even death. Serious infections are now occurring more frequently in nursing homes and hospitals. A condition called SIRS is the cause of many deaths in nursing home residents. It stands for Systemic Inflammatory Response Syndrome. Symptoms include abnormal vital signs, and if caught soon enough, it can be appropriately dealt with. If left ignored, a person can suffer from organ failure and even death. It is extremely important to get a patient's vital signs in the correct manner. When taking a person's blood pressure with a vital machine, the position and size of the arm cuff are key. On the cuff, there is a line indicating where the main artery of the patient's arm should go. Observe the size of the patient's arm and then decide which cuff would work best. Put the cuff on and press the blood pressure button. A normal and healthy blood pressure reading would be anything less than 120/80. Another extremely important vital sign to monitor is body temperature. An elevated body temperature signifies an infection is present. There are many different places on the body that read body temperature. An auxiliary reading, oral, ear, skin, or rectal are all appropriate. There is a probe on the vital machine that needs to have a cover on it before placing it in a position to read the temperature. Simply put the probe in the appropriate place and press the temperature button on the vital machine. Depending on which route you use, a normal temperature would be between 97.6 and 99.6 degrees Fahrenheit. A patient's pulse is also very important. Certain medications cannot be given if the pulse reads too high or too low. The vital machine will automatically take a pulse reading while registering a blood pressure. Some people feel that it is more accurate to take the pulse manually. In order to take a manual pulse, the healthcare provider must feel a pulse beat in the patient's neck or wrist using 2 fingers. Do not use thumbs, and count the beats for 1 minute. A normal pulse reading would be anywhere between 60 and 100 beats per minute. When taking a patient's respiratory rate, a healthcare provider must visually observe how many breaths the patient takes in 1 minute. Simply watch the patient's chest rise and fall and then keep account. Maintaining a normal oxygen level is vital to a patient's life. There is a pulse oximetry that measures a person's oxygen saturation. Place the oximetry on the patient's fingertip to read the oxygen levels. A healthy reading would be between 95 and 100%. If the percentage goes below the oxygen saturation normal range or drops even less than 80%, it indicates that the blood contains a very low level of oxygen. By taking a patient's vital signs regularly, we as healthcare providers are able to become a patient's advocate, identify their specific health needs, and set goals for treatment and care. Thank you.